Hi, my name is Carissa, and for my term paper, I wrote about the use of motivational interviewing within clinician-client interaction. So for the theory portion of my paper, I actually chose motivational interviewing, which is an approach and not a theory to talk about, because I feel very personally connected to motivational interviewing as an approach. I was a clinical social worker before I entered this program, and as both a mental health specialist and a hospital social worker, I've used MI religiously because it's such a great tool. It's very easy and very simple to learn, but something that definitely takes practice to get really good at. But it's pretty straightforward, and it helps you create strong bonds and relationships and trust within your clients pretty quickly. So what is MI? So MI is all about partnership, acceptance, compassion, and evocation. And what that means, it's basically empowering the clients to feel like their values and their beliefs and their thoughts matter, and that we should be advocating for them as as someone who should be an active participator within their health decision-making process. So what is MI as a communication tool? So you use MI by using a lot of open-ended questions, affirmations, and reflections and summarizations when you're communicating with your patients and clients. When you use them repeatedly and throughout the process of the conversation, it should help create a more open and honest discussion with your clients. So a brief intro to my topic. My topic is clinician-client interactions. It has a very patriarchal past where it was all about information giving. The doctors were always the ones that were making decisions for their patients and clients, and the patients were just expected to sit passively and wait for the doctors to decide whatever is best for them. So with the field moving towards a more a client-centered approach, it is no surprise that MI is increasing in popularity. But unfortunately, MI is not being properly used within health research right now. For the past couple of decades, as it has increased in popularity, MI has been improperly used as a theory. So it's being used in research studies to predict and explain outcomes when it's not supposed to be. Researchers are using it out of its scope and out of what it's intended to answer bigger questions in their research, and it's definitely not meant to do that. It is also being used to justify other interventions, which is not something you should be doing. As we learned from 666, we should be using theories to justify our interventions, not other approaches. It's also been used improperly within the same article as both a theory and as an approach. So that really doesn't make any sense. So where do we go with MI from here? MI is not going anywhere in this field. It's just going to get more and more popular. It's already, I think, something that's being used in medical school. I think everyone has to take classes on MI and know how to use MI when communicating with their clients. So why is it not that widely used yet? Well, MI is I guess it's a pretty significant change in your communication style, and that is not something you easily do as a doctor. It's pretty hard to kind of like take a step back and really listen to your clients and actively listen to them and really take their input into account, because that is really difficult when your client might not know what's best for them, right, according to you. And so it's really difficult to let that control, like, just take a step back and really actively advocate for them. So that's a really tough thing to do for doctors. So my advice for researchers moving forward with MI is that you should be using theory to back up the use of MI, because MI is such a strong approach, and you're just doing it a disservice by improperly handling it within your research studies. So I think two theories that would go really well with MI are the trans-theoretical model and the self-determination theory. Both of them have components that perfectly complement MI's components, and they could justify and explain the use of MI within the studies really, really well. So yeah, I think moving forward we'll be seeing a lot of MI, and I'm hopeful to see that researchers will be rethinking the way they're using MI within their research, and really trying to use theories to back up the use of MI within their research. Okay, thank you for listening. Happy holidays.